So Idaho's reopening more businesses. It must mean we're in the clear, right? We're about to get out of this coronavirus mess. Well, not so fast. Kim Fields talked with Central District Health today, and yes, while it appears we have reached a sort of a plateau when it comes to the number of COVID cases daily, they're worried that's creating a false sense of security for people.
So we learned this afternoon that the governor is moving forward with phase 2 in reopening Idaho. That's great news for a lot of people, but your office, Central District Health, they still have a word of caution for people, right?
Absolutely. Yes. I think that people need to remember that just because we're moving forward, it doesn't mean that we are going to be at lower risk or that things should just go on as nothing has happened. We understand and know what we're seeing across the globe, across our nation, that as places have reopened and allowed more businesses and more functional activities to occur, that more cases have occurred in those jurisdictions.
So Brandon, it seems like an obvious question that I need to ask. If health officials such as yourself expect an uptick as we reopen, then why reopen? Why move forward? Is that the best decision to be making?
Yes, because we have to be able to make sure that the public is aware that we want to move forward. We have to continue our lives, but we have to put other elements in place to make sure that we're reopening in an effective and efficient manner. And it can't be the same as it was before. It can't be, okay, go down to 8th Street on Friday night and party with the thousands of other people that are going out there, because we all love that vibrant downtown life in Boise. That can't be our normal when we're opening back up, and those businesses have to know that that can't be normal for them.
Sounds like your message is that we're not out of this yet. We're not out of this. We still have a long way to go, it sounds like.
We have a very long way to go, and I know that people are frustrated. People want to continue their lives, and unfortunately, until we have a better idea of all the ramifications of what this will mean to us as a society and as a culture, we have to be conscientious. But all it will take is having that disease in one location or one business here, and we know that people will become exposed, and that will spread from one location to another to another. So we have to be mindful of what we're doing. So let's use us as an example. We're here in Ada County and have one of the higher rates that's occurring with cases. If we see that in the next week and a half or so that our cases continue to climb, we may have to do some specific measures here in our local public health jurisdiction, and we'll work with local city officials to make sure that we're doing all that we can to help protect those within our jurisdiction.
Yeah, but we're just so eager to get out and resume our normal lives. But again, the message is hold back. We're not quite there yet.
Yes, be thoughtful about what you're doing. We will hopefully get there, but as we learn more and as we're able to take those steps forward, but again, not too far. We don't want to put the cart before the horse.
Brandon also told Kim that he can't re-emphasize enough the importance of wearing face masks. They may not be 100% foolproof, but he says something is better than nothing. And just the latest numbers, just to give you an example, we had 29 new cases just today, kind of hovering around 30 the last several weeks. So we're not seeing that significant drop off just yet. So yes, caution is still the way to go.